Welcome everybody. This is our third town hall tonight. I am Kayla Klingensmith from Pennsylvania. I'm here with Howard Kim from LA. We are both serving on the new Dentist Committee and excited to be talking to you about career paths tonight. Dentistry is changing and it's a perfect time to learn more about the options out there.
I definitely want to welcome everyone here. And I want to make sure that we say that we are not representing every single career path in dentistry. We try to be comprehensive and represent as many as possible. There are other options that we can fit into tonight, but we have just an hour. But please make sure to fill out our survey at the end and let us know what else you would like to see.
And I'd like to add that this town hall is supposed to be informative and honest. So get ready to get real tonight. So I'm going to start. I'm Kayla Klingensmith. I am an associate in Lancaster, Pennsylvania. I work mainly in farming community. So yes, there are people who come in a horse and buggy to my office. So I'm really excited to be here tonight and learn about all these amazing dentists with you.
I want to introduce myself. I'm Dr. Howard Kim. I'm from California. I'm actually a dental director at a federally qualified health center in Los Angeles, California, where it's been raining like crazy. So it's not always sunny in California. But I've practiced also in a DSO model in California, and I've also practiced in a private practice model. And so I'm familiar with the different career paths, and excited to all of you here. Excited to have all of you here together. And I think that's one great thing to be involved, to be able to listen to these panelists. So a few reminders. I want to encourage you to turn on your cameras. It is a town hall, so we're trying to make it a virtual town hall. So I want to encourage everyone to turn on your cameras if possible, unless you're in pajamas and don't want to show yourself. But please turn on your cameras. Please be active in the chats. We have people monitoring the chats at all times, but obviously be courteous and respectful. I want to turn this over to Tara, our director of the New Dentist Committee, and I want her to introduce all of our New Dentist Committee members across the country.
Hey, hello, everybody. I think at this time, why don't we go ahead and have the people who are here from the New Dentist Committee go ahead and introduce themselves in the chat and do it that way so we can keep moving with the program. So let's go ahead and we'll move forward with that. But please go ahead and introduce yourself because we are very happy to have everyone here from the New Dentist Committee. So go ahead and introduce yourself in the chat and we will go from there.
Before we hear from our guests tonight, we wanted to basically turn this over to just to start with our guests in terms of taking a quick poll. Do you want to bring up the Zoom poll, please? And so the question is how would you best describe your current career situation? And the second question is where you are today, where you thought it would be when you started dental school? Because we wanted to basically get kind of a general idea of who our audience is. So please answer these polls. So I think if we have a good, 75%, I think that'll be great to show off. There you go. And so I think this is a really good mix. I think it kind of correlates to what we're seeing with our data. But overall, there's some shift in our demographics and dentist workforce. A higher share of dentists are female and fewer people are going into practice ownership. That's what our data shows. And about half of private practice dentists work in solo practice. And we know that finding that right fit for you can be a challenge. And so a few years ago, the ADA launched a new service to help dentists do just that. So I'd like to introduce Dr. Byrd. Would you like to take over and talk about ADA practice transitions?
Absolutely. Thanks so much. Can we advance the slide? Thank you. Well, there have been a lot of changes at ADA practice transitions since we first launched the service back in 2019. In 2020, we went nationwide, so we now have practices and opportunities available in all 50 states. More importantly, as a general dentist myself, I realize the importance of finding just the right fit. And regardless of modality, you need to make sure that you're taking the time to carefully evaluate the situation that you're going to be going into. So if you use our service, we would love it because we have a ton of opportunities that are available. But even if you just check out our website, You will find so many wonderful resources, everything from leadership opportunity training to how to really have a successful first day in the office so that you are set up, because that's really what the ADA wants for you. And that's what ADA Practice Transitions wants to do for you. We want to help you find the practice where you can become, quite frankly, the dentist that you always wanted to be. So on the next slide, we do have a QR code. I would love it if you could just take a peek at it. If you're ready to find a new opportunity, even if it's across state lines, let us help you out. Now I'm going to turn it back over to you. Thank you.
Thank you so much, Dr. Ebert. I hope that everybody will look into the ADAPT website and learn more about the services. You may have heard about ADAPT before, but I will say I just looked on the website last week and there is some incredible stuff going on there, and they really have developed it really well. So let's go on to the main event here. We're going to introduce all of our panelists. And they're going to tell us just short, sweet, who they are and what they do. So we're going to start with the fanciest background. Dr. Byrd, would you mind introducing yourself?
Hi, everyone. My name is Kevin Matthew Byrd. I've served in a number of roles in both academia, thought about training as a periodontist and going to private practice, but currently serve as a research leader at the ADA's newest research institute, the Science and Research Institute. This is in Maryland, and still hold appointments in academia and the NIH, so kind of still wearing a variety of hats currently.
As all of you are, I am sure. All right, Dr. Collins, you're next.
Good evening, everyone. I bring you greetings from the great state of Louisiana. I currently reside in Lake Charles, where I work for a dental support organization called Benevis. And I am so happy and honored to be here. I also serve as a ADA success speaker. Thank you.
Beautiful. Yes, so excited that you and many of our other panelists also are involved in ADA success. And we're going to the West Coast. Dr. Schoblaske.
Hi, yes, I am in Southern Oregon, a city called Medford. That's about 4 hours south of Portland, which is the city that everyone knows. I am a dental director at a public health clinic, a federally qualified health center called La Clinica here in Medford. And I got here by going to OHSU, graduated in 2017, and then I completed a one-year GPR on the East Coast, and then I did come back to the West Coast, and I've been here ever since.
Beautiful. Thank you. And for somebody who already taught me something tonight, Dr. Alhajji, please introduce yourself.
Hi, everyone. My name is Dr. Dalal Alhajji. I am so excited to be here today. I actually graduated from dental school about 9 years ago now. I was an international student. I am currently a first-generation dentist. I had always envisioned a career in a private practice setting, but actually I am primarily involved in dental academia in New York City.
Beautiful. So excited to hear your story. And last but certainly not least, from the middle of the country, Dr. Johnson.
Hi, Jarod Johnson here. I am a pediatric dentist in private practice. I opened my own office from scratch right out of residency. It's been a journey, and I hope to share that with you tonight. So thanks for everyone attending.
Beautiful.
All right, Kayla. So why don't we start with Dr. Alhajji? I mean, I think you have some questions for her.
Yes. Were we going to do a second Zoom poll first, though?
I think it got incorporated into our first Zoom poll.
Gotcha. All right. Thank you for the clarification. This is why there's two of us. All right. So, Dr. Alhajji, we're going to start with you. I am glad I get to ask you questions because I actually do attend at a GPR once a month. So I love that you decided to go into academics. Can you tell us more about your academia journey and specifically why you ended up pursuing dental oncology?
So actually, interesting question. I never knew dental oncology existed when I was a dental student, not even when I was a resident. I'm a first generation dentist. I think I had a very narrow view of what options were out there. And I had always envisioned primarily working in a private practice setting. And when I was a fourth year dental student and I was applying to residencies, I basically selected to go to a residency to support that dream. And it was primarily in a private practice setting, but there was a small portion of it that involved hospital dentistry. And it was through these small interactions that I started to have a very strong opinion about treating medically complicated patients. And I had to make a big decision at the time. I recall one of my attendings telling me when I was a resident, and he was being sarcastic, but he was saying how the only thing they teach you in dental school is how to hold a handpiece. And I was like, I sure hope not, because that was a lot of years. But he was trying to tell me something there. He was trying to teach me that you don't realize how much you don't know until you actually do a residency. And I didn't realize I had such a passion for treating patients who needed me the most. And I ended up making a big decision by going back to school, which was a big decision at the time because not only did I have to pay tuition all over again, but I actually had to sit through all the basic science courses that I thought I was done with, including microbiology, head and neck anatomy. But I learned so much. I also dived into basic science research and I acquired so much information. And I wanted to be able to translate that information into a clinical setting. So I ended up doing a fellowship in dental oncology. And right after I was done with my fellowship, I knew dental academics was the career choice for me, especially if I wanted to dedicate my my lifestyle or my career lifestyle to treating the medically complicated patient population. So as a result, I did end up doing dental academia, and I'm so grateful. I primarily see patients with cancer, and I feel like because of that, I am able to just showcase more cases since that's really all I do now.
How many dental oncology fellowships are in the country? Do you know?
Yeah, the last time when I looked about a few years ago, there was like only 2, but now I think there's about a handful. So still not a lot. There's not a lot of us out there. So I definitely didn't want that training to go to waste, and I definitely wanted to be able to implement it.
Okay. Now, I know you are a couple of years out of school now, but still probably one of the younger instructors at the school. What's it like having students that are maybe closer towards your age, and how do they deal with that? Yeah.
I would say that's actually another big driving force to why I chose to do dental academia. I think it's just so rewarding because I relate to my students a little bit different. I'm able to mentor them and give them advice that they really take to heart because they know I've been there, done that not too long ago. So they really value what I have to say, the advice I have to give, or the content of my lectures. And that's been so rewarding.
Beautiful. While I think I still have a minute with you, I'm just gonna go off the cuff. What would you say? I'm in private practice in the middle of nowhere. I do have some patients who do have head and neck cancer. What are good resources for those dentists out in the middle of nowhere who don't have a ton of resources or referral options?
Yeah, so there are actually a lot of CE, you'd be surprised, a lot of CE courses that walks the general dentist on how to work up a case for a patient who has cancer. And I strongly encourage everyone to sign up because I always tell my students, at some point in your career, you're going to encounter someone who has cancer. So it would be in your best interest to know what to do. There's definitely a lot of CE courses. I actually came from one last weekend. I went all the way to Canada for it, but they are out there. 2 red-eye flights later, and I would say it was definitely an excellent presentation. So
beautiful.
They exist. Yeah.
Well, I would love to hear your presentation as well. I hope you.
Oh, I would be honored to give
Okay.
one.
Well, there, we're going to put that in the brainstorming session there. Thank you so much for your time.
You're welcome.
But I would love to invite people who want to learn more about Dr. Alhajji to put some questions in the chat. I think the panelists could try to answer them themselves. If not, we'll have a quick session at the end where you can raise your hand and kind of go on camera to ask your question. But now we'll move on to our next panelist. I'll be talking with Dr. Schoblaske, and she is a dental site director at a federally qualified health center. And I want to kind of ask her, basically, could you first explain your role and how you got that position? Because I feel like we have a lot of new graduates in this audience, and I don't think they know what a dental director is. I sure didn't when I first started. So I want to kind of start it off by explaining your role and how you got to your position.
Sure, yeah. So what my role is, I'm technically a dental site director. So I oversee a 36 chair clinic here that I'm sitting in right now. And when we're fully staffed, we have 10 dentists here, and I collaborate with all of those dentists. And we have 4 office managers within this office because that's a big clinic. And so I collaborate with them to make sure that our scheduling is working well for our patients and for our staff. I also do some education components. Today, I talked to some of our staff that do home visits and made sure they were up to date on the information they're sharing with our patients about oral health. So I do lots of different projects. I've been in this role for about 2 years. So I worked as a general dentist here full time for about 2 years and then got promoted into the dental director role, largely because I expressed an interest in leadership and the previous dental director left. So it was some lucky timing. I got here before that. I've always been interested in public health. I've known I wanted to be a dentist for a long time, but kind of in undergrad, I was working with some teachers who worked in low-income schools. And when I expressed my interest about dentistry, they were like, oh my gosh, do you know how our students can get connected to oral health? I didn't at that time, but that was a seed that was planted that I really wanted to be part of the solution of getting access to care to more patients. And that is exactly what federally qualified health centers and the public health network is all about. So I was like, that is for me. So I've been bought in all along. And I did pursue some student loan repayment. So that's been an added benefit along the way. I got about $140,000 of my student loans forgiven through the National Health Service Corps because of my position at an FQHC. So that's the short version of how I got here. Awesome. And what my hours look like, it means I see patients full-time 3 days a week, and I do admin stuff 1 day a week. So I still see lots of patients every week.
So I think this question is a lot for the students. Like, what do you say were the differences between working at an FQHC versus working in a private dental practice?
Yeah, I think one of the biggest differences is that I love, like I mentioned already, how much I get to collaborate. And it means that I am very much the analogy we use a lot is that I am a shipmate, not the captain of the ship. So in a private practice, you as the owner doc, you get to be the captain of the ship. You make the final decisions, you get to decide exactly the schedule. I don't get to make all of this decisions about my schedule or how we talk to patients at the front desk or exactly how everything is done. And sometimes that is challenging and sometimes that is awesome because it also means that we have a whole billing department that manages our billing and I don't ever have to talk to an insurance company. If the toilet breaks, I tell our operations team and they fix the toilet. If the roof leaks on the weekend, I can enjoy my vacation because someone's job is to tend to that. And so that's one of the big differences. Our patient population tends to, have a higher degree of behavioral health history, a higher degree of substance use disorder, higher degree of houselessness. About 60% of my patients are on Medicaid. So we get a specific patient population. And another difference is that most times compensation is pretty predictable in public health. I'm paid on a salary. And so as a new dentist, having a budget was really important to me and knowing exactly where I could put my money each month. And so knowing that I would get paid the same thing every month was really nice. And I know that that is not always true in a private practice setting. So those are some of the key differences.
Awesome. Last question, especially for the attendees, what do you think they should know about FQHCs and about applying to jobs for FQHCs? Because I don't think that's very commonly known. And if they're interested, how would you go about applying for a job and just kind of getting a background of that?
Yeah, most dental schools do rotations at FQHCs. And so if you did an externship in dental school, that's a good place to start. Or asking your classmates if they had a positive experience on their rotation and reaching out to the clinics where they did that. HRSA, which is the Health Resources Service Administration, HRSA, also has a resource called the Job Connector. I'll look it up and put it in the chat. And that's another great place to find jobs that are available in FQHCs.
Thank you so much, Schoblaske.
Yeah, thank you.
All right. And Dr. Schoblaske, I think there's already a question for you in the chat. So something
I will get to it.
Something to go for you there. All right. Now we're moving down to Louisiana and Dr. Collins. Woohoo! I will say that Howard and I had the privilege of getting to know Dr. Collins a little bit more. So I am so sad that I have such little time because I just really enjoyed your story. So let's get to the highlights. Is there anything that you feel that the DSO pathway offers that is not often talked about?
Yes, one of the things I feel that is offered is number one, an opportunity to be promoted within the organization. So I started out as an associate dentist, was promoted to senior associate, and then there's opportunities to move up to state dental director and regional dental director. Something else, dental support organizations give back, and that's something that is not often talked about. So about 3 years ago, my organization offered me an opportunity to travel abroad. So they did a mission trip to Bolivia, and of course, there was applications from dentists from all of the states that we cover, Louisiana, Texas, Georgia. And I was fortunate enough to be one of the 4 dentists selected to be on that mission trip for that year. And then the following year, they selected a group of 4 dentists to go to Africa. And so that giving back, that is something that isn't often mentioned. And we actually have a Smiles Day coming up on May 21st.
Awesome. That's a lot of different outreach opportunities for you.
Yes.
Can you talk a little bit more about what you're doing right now and why you have decided to stay at a DSO?
Great question. So hurricanes in Louisiana, we have hurricanes. Everybody know COVID affected all of us. A lot of our practices were shut down. And after COVID, we had a Hurricane Laura, Hurricane Delta. So I lost my practice here in Lake Charles. The office was completely destroyed. But because I work for a DSO and there were multiple practices throughout the state, such as Shreveport, we have 3 offices in New Orleans. There's one an hour away from me in Lafayette. I had the opportunity to travel to other locations and stay employed. So that was something that kept me with my company versus someone else may have had to close their practice, start all over or move somewhere else. So that continuity of care was able to be given. And now that we're in the process of rebuilding our practice, I currently work in a temporary trailer and we are expected to open our office next month. So I'm excited about that.
I'm sure you're excited to get out of that trailer. I'm sure
yes,
you are.
Ma'am.
I mean, I don't think you probably ever thought in your career that you would be doing dentistry in a trailer.
No, ma'am, not at all. And I love mobile dentistry. And that is something that I get to participate with the military sometimes, but in this environment, and I only have 2 chairs. So yeah, we're in the process of preparing for our grand opening next month. So
beautiful. Great. Kind of last question. I think you kind of already answered this a little bit, but is there any ownership pathway at a DSO, and especially the one that you work with?
Not at my specific location, Lake Charles, but yes, there are definitely opportunities for ownership. At one time, our company was even acquiring private practices from dentists that, you know, didn't want to do that anymore as well. So yes, definitely opportunities to become an owner in a DSO.
Great.
Well,
Beautiful.
thank you so much, Dr. Collins. You're welcome. One thing that we were talking with Dr. Collins about, and her DSO encourages her employees to become ADA members and participate in organized dentistry. I feel like that may not be the culture in a lot of DSOs. And so that's very encouraging because we're all working together. A bunch of us were at ADA, ASDA lobby day. And so we're not only fighting for all of you because we had a bill talking about, you know, reducing, you know, providing more Medicaid for all our patients and reducing, you know, loan debt. And so I want to compliment Dr. Collins on being a part of a DSO where they encourage the people to become ADA members. And so moving on, we wanted to hear next from Dr. Byrd. And so Kayla and I, we were excited. We met Dr. Byrd before this the Zoom meeting, and you know she has an incredible journey. And science and research not be something that we rarely think about as a career path after your training or after dental school or residency, but it's definitely something we can do. Dr. Byrd, could you talk about your journey, how you came to work at the ADA Science Research Institute, and more specifically, how you ended up with a DDS and a PhD?
Yeah, thanks, Howard. It's great to be here and with everyone on the call. I also came in without a lot of experience of what dentistry had to offer and maybe its fullness. I'm a first generation student. And so when I came to college in dentistry, I was exploring a lot. And so when I got to the University of Michigan, where I did my training, we were introduced to research, but also introduced to service. And so at different times, if you'd have talked to me, I might have been interested in oral surgery or working in a public health setting. At one point, I was interested in oral pathology. It frustrated my partner to no end to talk to me depending on the week or the month. I eventually decided that I just loved the concept of treating patients in surgery, but also still doing research, which I got involved in at Michigan. And so I was looking for places to create my own program. And so I went down to the University of North Carolina, where I enrolled in a periodontology certificate, but also a PhD. So I kind of crafted my own residency that way, and intended always to get back to residency pretty quickly, but just kept soldiering forward on research. And I started getting grants for myself, sometimes very early grants that typically faculty get. And I was able to use those grants to fund my own program. So I became a faculty at UNC and a resident. And then COVID hit. I think like many of us, it was disruptive. And so I got a call from the ADA, and I'd been a success speaker. I'd been on the Council for Scientific Affairs. And so they had an opportunity for me to do what I did at UNC, but to do it with them. Since that time in the COVID, I've actually taken on other roles at the NIH, continued working with them and still at UNC. And I've recently taken on some positions in industry. I'm a scientific advisor for a company outside of RTP working on oral health. And so we're competing for phase 1 funding. And so I think there's really an opportunity to kind of bring the patient experience and industry and hopefully make a positive impact.
My next question is, can you talk more about ways to get involved in science and research that may not be a full-time position? Because I think a lot of our attendees are not, able to, do something full-time in research, but something that they can do part-time, they can get involved with.
Yeah, Howard, that's another great point. I think it oftentimes feels like research is all or nothing, but obviously treating patients in its essence is part of a research enterprise. And I think one of the easiest ways to get involved is to think about even referring some of those zebra cases that you just don't know what it is, but you're not comfortable. Start talking to pathologists in the area, having a network to refer locally. And there have been times that even in cases that I saw or cases locally at the NIH that I've seen get referred to the NIH. And sometimes they get a workup, sometimes that becomes papers. There's ways for you to be a good referral network, I think, but also to keep that curiosity on what it is that's normal and different. And I really think that that's actually a way for us to benefit our patients and making sure we're linking private practice to academia, to federal, and to industry. As you said, it's a network, and I think the better we work together, the better we serve our patient populations.
So my last question, Dr. Byrd, is, we definitely have overwhelming majority of practicing dentists that are part of our attendees and are thinking about practicing. Could you talk about like that trajectory shift in your life, like and how you develop a passion and like that point in your life where you're like, oh, this is what I want to do, to kind of encourage, people to look into this?
Yeah, so when I grew up in the Midwest, and there was an attitude of saying yes, and being a good person was not bucking the system too much. And so I was always told that, just kind of go be a dentist, go be a oral surgeon if you want, but try your best just to get back to Indiana and set up shop here. I had an oral surgeon's office I thought I could go back to. But there was that gnawing questioning, and I couldn't get it out of my mind. And it took me a long time to hear that inner voice and to have the courage to make the leap. And once I did, I got more comfortable with that idea. And so a lot of the things you're seeing me do now is because that reflex maybe to resist has changed a bit more to being open to new experiences and taking some risks, as long as I feel like the risks are rooted in my ultimate goal, which is to hopefully break down the oral systemic divide and treat patients to the best of my ability.
Well, thank you so much for talking to us, Dr. Byrd.
Thanks, Howard.
Mm-hmm.
Thank you so much. I honestly didn't know that before meeting Dr. Byrd that there was dentists that actually worked for the ADA. So very interesting. I thought you could only volunteer. So sign me up someday, right?
Dr. Byrd published a research paper about COVID in the mouth, and that just like blew up too. So we were fascinated about it too when we're talking to him before.
Yeah, that's great.
Thanks, Dr. Kim. That's very nice of you to say.
Maybe you'll post it in the chat.
I can do that.
Thank you.
All righty. So not last but certainly not least, Dr. Jarod Johnson, you are a specialist and a practice owner. Can you talk about your role as a pediatric dentist and a solo owner? At what point did you decide to buy, and what was the experience like for you, especially straight out of residency?
Absolutely. So first, I want to start off with just a message from us at the ADA that I've been in situations where, I'm in private practice. I know the ADA's had this, I guess, kind of thing where you go to a meeting, you say I'm a DSO dentist, you get put down. And I was just at the airport last week traveling to Pittsburgh, and I met someone in academia. He was reading a journal that said oral path, oral surgery, oral medicine. I knew that because I had read that journal. I said, "Are you a dentist?" And he said, "Oh yeah, but I'm in academia." And I said, "Oh, that's great. That is a great thing." It's like, I didn't want to deal with the staff, the HR, like all the hats you have to wear as a practice owner. And we talked for like 15 minutes. We had a great conversation there, but there is a way for you in dentistry, no matter what you want to do. If you want to go to DSO, you want to go to public health, that is great. Do what you want to do what makes you happy. I am not going to be in private practice forever. I'll probably go to academia like my parents were. And I know my parents were in academia, and people always have the stigma that they couldn't make it in private practice. That's not true. That is simply not true. That's the career path they chose. So I just want to welcome everyone, whatever you choose. The new message from the ADA is that everyone is welcome. You are accepted no matter what you do, and you are going to make a difference, because there is no other way to help other people do what you do if you don't have a passion for it. And if you're stuck in a career you don't like, maybe look at one of these other pathways. So that's just my first message. My answer to your question is, I decided I want to go into pediatric dentistry very early. I always knew the question earlier, are you where you want to be now? And I always knew I was going to open office. I just knew it. I'm a creator. That's my personality. I don't want to have it any other way. And I've really enjoyed it. It's not easy. I'll tell you that, being a practice owner. When COVID hit, you got to decide all that stuff. Like Dr. Schoblaske says, when you have poop backing up out of the toilet, you got to figure out how to call a plumber, get the toilet pulled, get that line drawn. Like, there are things, I can tell you multiple stories about things that I never would have dreamt of having to deal with as a practice owner. And it's also rewarding though, because I get to call the shots. I get to make the decisions. I can say, I want this time off. I want to do XYZ procedure. I want to buy this material. And that's rewarding too. And I've also been able to get loan repayment going to an underserved rural area, which I think is important for me to be able to get back to my community and just be a part of where we are in my community and treat underserved kids and use my skills to the best that I can. So that's kind of what brought me to this place. And thanks for the question.
What made you think pediatrics is for me? Like, I want to work just on kids.
Yeah, that's probably a lot of people dread that, but it's just every day is different. I get to do general dentistry every day and on kids. And what really started it was in dental school. I got to work with the young kids, and I feel like I could handle that a little bit better. And then I was a coach prior to that with the teenagers at the junior high that I went to. And it's just so rewarding building relationships with these kids. I can't tell you how many kids I've had come in when they're 3, 4, 5 crying, won't even sit in my chair. And now like they're my best dental patients, and I can do extractions, fillings, crowns on them. And you just build that experience and create a positive experience. And that is just, to me, to make a difference in their lives. Like that is so rewarding when you have the parent that was there and they were held down as a kid and strapped to a papoose board, and they're like, did you take out the tooth yet? And I'm like, yes, it's already done. It's just so rewarding to have that experience.
Yeah. And I am so glad that God created people like you that I can refer to. So much so. So I personally have always worked with other dentists. So as a solo dentist, what is challenging? Where do you find your support as being the only dentist, the only one who understands what you're doing in the practice?
Yeah, I think that's probably now with COVID, and I mean, I've experienced mental health issues as well. I'm very open about that, but that's probably one of the most challenging things as a solo private practitioner is you don't have someone else there to bounce something off of, and you really need to build your support. And what has really helped me is all the people that you see in front of you. The ADA has been very supportive. I'm also very active in dental communities, Dental Town. I am on every day looking at other cases, what other people are doing. The Facebook groups and social media can be a little bit of a challenge, but they're there to see other cases, and not everything on there is true, what you hear about the ADA and what you hear about cases and things. But also for me is find a mentor. Find someone that you can talk to. I just got off the phone last night with one of my mentors, and he was having a bad day, and we were talking about mental health and talked about what we're doing. And he said, "You were on sertraline, right?" And I said, "Yeah, it helped me at the time." He's like, "Maybe I'll bring that up to my doctor." And we talked through that a little bit. And then I texted him today, just say, "How are you?" And he had some water leaking in his office. And it's like, hey, that's not a big deal. That's fixable. It's just money, right? It's not, nobody died. So having someone you can talk to. And I think from that, you'll realize when we have these conversations about situations where we had a difficult parent or a patient or clinically, we find that they had the same situation and they can tell you the answer and you're not alone. So find someone that you can talk to and call up. It's really, really helpful to have someone that you can trust and just have a one-off. You can call them. They may not get back to you right away. It may be 2 or 3 days later. They're busy too. But if you can get that off your mind, it's just really helpful from a mental health aspect. And when you're on your own, it's really nice to have a mentor or a peer that you trust, and maybe even multiple ones.
Beautiful. Yeah, I can't name all of the people who've played a role in my journey so far. Yeah, so it's truly incredible. Also, shout out to Dr. Johnson and all of his internet fame of both Instagram and Dental Town. And I knew him before I worked with him on the new Dentist Committee just from seeing his posts. So very vulnerable when it comes to what dentistry is real and what it's actually about. Beautiful. All right. Thank you so much for answering our individual questions. Now, at this point, I would like to open it up to questions from the audience. The way we're going to do this is if you can go to the bottom and raise your hand, that'll bring you up so you can unmute yourself and actually ask a question to the panelists or to the whole group. So
I would love to ask a question.
Awesome.
Hello, I'm Diana. I'm from New Jersey, and I'm a pre-med at Georgian Court. It's not really a question. It's just like, when you're pre-med, you don't really know what to do. You following so many, you watching YouTube, you're doing so much research. You don't have, I found it's really difficult to find a mentor to show me the path. I know life is struggle. First of all, you have to struggle. Everyone in here struggle in life, but I need this mentor to tell me this is what you have to do. This is what you have to do. Not having to do like so much mistake before I get to what I love to do.
Dana, thank you so much for your question. I think this is a great question for all of our panelists and even all of us here. Like, we wouldn't be where we are without our mentor. So I open it up to all of our panelists. This is an awesome question about where Diana could find a mentor, where she should look first.
I think Dr. Collins should answer that question.
There you go.
Yes, I am definitely willing to mentor you. My brother actually used to live in New Jersey. He works for Lockheed. So I'm very familiar with the state of New Jersey, and I have several friends there. So I would love to mentor you. I can definitely point you to the right direction. And if you send me a direct message, I'll send you my email and contact information, but I've already put my email also in the chat for anyone else that is looking for a mentor. So I'm your mentor.
I think this is a perfect example.
Yay, I got a mentor.
I think this is a great way of just like, hey, put yourself out there. Like, that's a really, I think, the biggest thing here. Dr. Alhajji, would you like to, working with students, I'm sure this is something that they ask a lot. Would you like to comment on this?
Yeah, so in my experience, I found that the students I mentor, it can either be in a setting. So sometimes if you actually go into dental school, there are programs like a big brother, big sister as the program. So you kind of walk into dental school with a mentor already, which is super nice. I work at NYU. At NYU, I oversee a group of, we have there are 400 students per class. I oversee 28 senior dental students, and I mentor them very actively across their 4 years. So sometimes it's like set up so nicely, and I know that a lot of institutions have that. But beyond the, besides the 28 mentees that I have a lot of mentees that just happens organically in the clinic. I have yet to see one mentor turn away a mentee. It's always a supportive environment in an academic setting, I find.
Yeah, there's still teachers that I'm still in contact with.
Yeah, me too.
Yeah, I think that's keeping those connections close and finding the ones that really inspire you.
Oh, yes.
I had a few advice. Can everybody hear me okay? Because my sound has been breaking up a little bit, so I want to make sure y'all can hear me.
We can hear you now, loud and clear.
Perfect. Thank you, Howard.
You're welcome.
So for me personally, I was kind of a first generation dentist. I didn't know many dentists in my community that I was coming back to. What I personally did is called every dental office in the city I wanted to work in, and just happened to have one dentist that invited me to a monthly meeting that the dentist in this area had. And so he invited me. I went, it was one Tuesday night. I went and had dinner with them, and then got in touch with someone who said, here's a really good lady to mentor. And then she eventually actually has become my boss now. So that's kind of how I did it. And especially if you're going somewhere out of state or in places that you don't know people, what's the harm? Somebody just say no to you. So that's kind of.
Yeah, I think that this is a really hot topic. Even I'm just monitoring the chat, and even Dr. Katrina Montaigne, she was talking about, mentorship, because I think this transitions perfectly, because I think it's important to obviously find the career path that you're interested in. And, I'm sure every one of our panelists has had a mentor to get to where they are. And so, we definitely encourage, I think that the chat's very active about, we definitely encourage people to reach out, even to our panelists, Tara, I believe, we can definitely have some of their contact information. So even after this presentation, I feel that they can reach out to them. Is that correct?
Yeah, I'd be glad to help connect anyone who wants to contact me or Melissa, and we can put you in touch. There's also a place in the survey at the end of the town hall that you'll be able to enter your name in there too. So easy peasy.
There you go. And so, this is a town hall, so we still have, we want to be on time. We want to respect your time. We still have 7 minutes. If any brave soul wants to ask another question, we've had some awesome speakers here and panelists that can answer your question. Does anybody like to ask a question?
It looks like a couple questions on managing your student loans and how you do that. So, which is, not easy. So I would say could do that, or if you wanted to turn it back over to your panelists who have anything else they want to share.
No, I think that's great. Yeah, I think that's great. I think any of the panelists could answer that, because I feel like a lot of attendees here, I myself have over $500,000 in student loan debt. And so I think a lot of us are on the same boat. So whether you're doing research, whether you're in private practice, DSO, oncology, I think that'll be a great question, because I think that is literally on every new graduate's and every new dentist's mind.
I'm going to chime in. I'm going to say, because one of the questions I know we had discussed for me was, what's one thing you wish someone would stop saying about, or everyone would stop saying about your career paths? And I'd love to hear from everyone what, what's one myth we can bust here today.
Let's start with you, Dr. Schoblaske.
That's easy because I got an answer ready.
Okay.
I think the thing that I wish people would stop saying is that public health is a temporary stepping stone. I heard that a lot when I graduated of, oh, are you just doing to pay that? Are you just doing that to pay off your loans? Or, oh, is that just temporary until you find something more permanent? Or, oh, that's just to get the wiggles out before you go into private practice. And I was like, no, I want to stay in public health. And I practice with 6 other amazing dentists, and 2 have been in public health for 9 years. 1 has been in public health for 11. 1 has been in public health for 14. And we are all like in it for the long haul. And so I think that's what I would want everyone to know, is that it is a career path option. It is not a temporary stepping stone, and people have long, successful, enjoyable careers in public health. And I'd love for you to be one of them.
Dr. Alhajji, being a person who's graduated, 9 years out of school, how have you managed your dental school loans?
So that's another, I'm going to be answer both questions actually, because that's one of the myths that I have also encountered, that being in dental academics does not pay the bills. Why would you ever want to do such a thing? But there's actually a lot of flexibility that I think people are not aware of. So when you get involved with dental academia, you can even just do it part-time. And I think it's so rewarding. You can do it full-time, but actually I'm enrolled in a modified full-time. So that means I don't work like the full 5 days. I actually do dental academia for 3.5 days. And then I dedicate a day for private practice. And that really, that helps me, that's, basically helps me increase my availability for my patients. So that's like one of the myths I want to debunk. It's not bad at all, actually. And I find that the opportunity is just so rewarding and rich in so many ways. So for example, I find that if I wasn't in dental academics, I wouldn't be pushing myself to work on my public speaking skills, because there are 400 students per class. I often have to lecture to 400 students at a time, or even being able to put presentations together. In terms of student loans, because I did go back to school after dental school, so I did acquire a lot of loans, and it's still a work in progress, but it's definitely doable. It's not hard. I work with a financial advisor who I love. So I'm also very proactive. He doesn't even live in New York, but I'm also very proactive in seeking support and finding a team of people to help me pursue my dreams. And he's just one of those people.
Great. Dr. Collins, Dr. Arnell, right? She also is a DSO dentist and talked about wanting people to stop saying, use it as using DSO as a practice to get your speed up. Can you talk a little bit more about that and comment on that myth?
I started in public health first, and then I moved to a DSO, and there is a difference in the amount of patients that are seen because the goals are different. We know in public health, it's about how many encounters per day versus in DSO, it's more of a business model. So, you know, the approach with the patient that has 4 fillings in public health for me was maybe 4 visits. Compared to the DSO I work for, we might get that down in 2 visits, or maybe if possibly basically doing as much as possible. You do get faster because you see more patients. And for me, in the state of Louisiana, we have a very, very low reimbursement rate. A patient comes in for a limited exam, an emergency visit, the reimbursement is $15. $15 for a limited exam. And I also work with children. So if I have to clean a child's teeth, it's going to probably take me 5 to 10 minutes and not me, the hygienist, compared to an adult patient that is seen. So we are able, again, to see more patients. So it depends what the goal is. So as a result, you see more patients, and of course you're going to get faster. But yeah, I agree that it is totally a myth.
Yeah, thank you. I saw Dr. Johnson about, you know, you're a good person to respond to this, that you can't buy a practice right out of dental school or right after graduating. Can you expand on that myth and the fact of that you're sitting here?
Well, you can do whatever you want. You're going to be successful. So if you look at the statistics, about 2% of dental practices fail. So banks, when I came out, they gave me a loan for, I'm a reverse millionaire. They gave me a loan for the building, all the equipment without anything down. And that's not true today. That's not where we are. That was where it was when I graduated. But if you have the creative mind and you want to do something, you're going to be successful. I would recommend you look at the area, because if you can buy a practice that already has income, that's a better decision than opening. But if you look at the opportunity, you maybe want to be in a different area, then maybe open. And I think you can do it. As far as I think what the myth is with private practices, I think there's a lot of misunderstanding of income and how as an owner, you may take a salary, but you may take a K-1. And I don't think that's always understood by dental students that, yeah, you're going to take a salary as a W-2 of your own office, but you're also going to take a distribution as the owner of your LLC or a corporation. And that's not always, I think there's misrepresentation of income. And as far as student loans go, I graduated, I think, around 380. I took IBR when I opened my office, didn't take a salary for months. It got up to 432. Took some loan repayment through the Iowa Fine Project. That was 80,000. COVID hit, and that was really helpful to have 0 interest. And now I'm down to 37,000 and just sitting on that until we see what's going to happen with things. But you're going to be fine. Whatever you do, you're going to be fine in academia. You're going to be fine in public health. You're going to be fine as a dentist. It is a very rewarding career, and it may take some time, but there are ways to tackle it. And I know that's a lot of money, but it's definitely something that you can tackle, and don't let that stress you out over your life. Just keep chipping away and get the best advice. Like someone else said, is get an advisor and figure out what's going to work for you.
Yeah, good.
I had one more thing on the student loan front, just that I think ADA recognizes that there's the folks that are currently paying off loans, and there's also looking ahead to making sure that dental school stays affordable and that dental school doesn't become an unattainable goal in the future. And so that is one of the advocacy and legislative priorities that the ADA has. Like last week at Lobby Day, one of the bills that we were lobbying for is about reducing interest during residency programs, or stopping interest during residency programs. So just know that that is something that's kind of a two-wheel thing, that you can do it. We've all done it, and you can do it. And the ADA definitely is looking ahead to the future and advocating on your behalf to make sure that you really can do it, and making sure that that pathway is an option for you.
We had this last question from Katie. She wanted to hear about the panelists, about what benefits do you gain the most from organized dentistry that support or complement your career path. Dr. Byrd, do you want to take this on because you work directly with the ADA?
Yeah, I've been an ADA member since I got out of school in 2013. Honestly, when I was in school, it wasn't as clear to me what the benefits were, but it always seemed that when getting out that we'd be stronger if we were united together. And it always seemed pretty clear to me that even if I was going towards a research path, that I always felt the ADA had a large tent. And I've always found that to be true. And so when I would go, to, let's say, to a research meeting, right now I'm in Portland instead of being in Maryland, and I'm at a research meeting. And 6 years ago, I met Kathy Laughlin at this meeting and told her about my interest in making sure that a part of Pathways research was considered. 2 years later, I was, without even asking, I was included to be part of the Success program. And Kathy would sometimes email me and ask questions, and we would go back and forth. I think that there's always been an interest. I think that was, Jarod said this really, I think, beautifully at the beginning, was that I think that there's always a space in dentistry for all of us. I think the ADA provides that. I think the way in which the lobbying happens benefits all of us. I think the way in which there's community is a benefit. It's hard for me to see the lack of benefit, but I think that it's easy to divide us by not clearly presenting those benefits.
That was beautifully said. Thank you so much, Dr. Byrd. It is 6 p.m. in PST Pacific Coast and 9 p.m. in East Coast time. And so this has been so great. I want to thank all of our panelists. I hope we'll all stay in touch. And I wanted to share a few slides at the very end. And if you want to schedule a program like this at your school, your dental society, please reach out to the new Dentist Committee staff or your representatives. And as well as the ADA PT, the transitions program. Kayla?
Yeah, so, and definitely look at this ADA Success Program speakers. You know, you can do this as a new dentist event or even just an event for your local society. Dr. Schoblaske, Dr. Collins, and Dr. Johnson are all ADA Success speakers, and I'm sure you'd love to hear more from them. And then let's pull up that QR code for the survey. And please download the member app. If you haven't, you should have already. It's been out for months now, guys. So download the ADA app, and there is Dr. Wright for us there as well. Yeah. And I think, oh, sorry, that's their survey code. Apologies. Beautiful. Howard, do you want to close this?
Yes, and so you know, please tell us what you thought about this town hall and this survey. There's a QR code there, and in the chat, Tara will put in that survey code or the link. But before we close, I do want to say that we're offering 1 hour of continuing education for the attendees, and we'll get that letter to you in about 2 weeks. We hope that you'll join us for our next town hall. It'll be on pregnancy and fertility, which is a very personal topic. But I think, you know, as new dentists, as students, as people that are graduating, I think this will be a very relevant topic for all of us. I know that this is something that our generation is dealing with, and we think that, you know, starting families and growing a family is a very important topic beyond dentistry and incorporating dentistry. And basically, you know, I think it's important to talk to one another and listen to one another. And Kayla and I just would, you know, basically on behalf of the New Dentist Committee, on behalf of the ADA, we want to thank everyone we want to thank our panelists. We want to thank everyone for joining us tonight.